Dr. Philip Brown became a more significant presence in our community this year amid COVID-19 as NHRMC's Chief Physician Executive. But beyond just his official duties, Dr. Brown built a big following on social media around healthcare precautions as well as racial justice issues. He also this year became the president of the North Carolina Medical Society. Dr. Brown will talk today about how to improve our community's health beyond COVID-19. Please join me in welcoming him to the stage.
Good morning. I'm going to try to do this in a mask as long as everybody can hear me. Can you hear me well enough with the mask? Great. I have a feeling that all these talks are going to be connected, as well they should be, because aren't we all connected? And the trick is to find out what that purpose is, how we marry those together and make things happen. And COVID-19 gave a perfect example of what that might look like. You've heard about that in the last two talks. I think it's remarkable, and I think the opportunities that are in front of us based on that are something the likes of which we have never seen. But we do have to get through some things first. So my personal purpose is to help people find pathways to health. I attack that in my professional life, and I take it to my personal life as well. And by constantly seeking different opportunities to pursue that purpose, those opportunities present themselves often. And that's how we came about with the Swimclusion Northside Swimming Partnership, right? So born out of a need of a place to swim for a group of kids, including mine, incorporating the knowledge that we did from a Northside community assessment that said we have a need, and bringing the resources together to put a pragmatic approach to solve a problem which exists as the third leading cause of death in children, accidental drowning, and make a difference in Wilmington. So it really was about first defining that purpose. But just knowing what your purpose is will never get you anywhere, right? How are you going to make all of Wilmington, New Hanover County, and now with the state position, all of North Carolina healthy? Right now, North Carolina is number 36 in the country in overall health. It's terrible, right? New Hanover County is only number 19 in North Carolina, and amongst our region, we are the shining star because our average rank is 55. So it takes a lot more than just knowing what your purpose is, and that's where connection comes in. Okay, so the next piece of the connection, you connect through purpose, but you have to connect people. Who are the people that you need to promote that purpose? And I will tell you, one of the things that I think we see in our community very commonly is an incredible number of well-intentioned people doing wonderful work that is too disconnected to have long-term efficacy. So we can work on that, and COVID has provided some tools of how we can do that in more effective ways. But this whole concept of health takes more than just making sure that our decisions aren't made in rooms with people who look exactly like us and think exactly like us, right? We have to then connect perspectives. We have to connect the perspectives that exist, that are factors in this ecosystem, because we're all connected in some way or another, through purpose or through what the effects of policy do to us. So we have to connect that perspective, and if we do that, we begin to create an atmosphere of belonging. This is where we really begin to get warm in the concept of what population health starts to look like. When enough people understand how they belong in the ecosystem and can make meaningful contributions, be they economic, educational, or any sector, things start to work. But the job is not complete, right? So you have to group those people based on purpose. And then you have to be willing to hear all the perspectives. Because the next step is where you have to define your principles. So what are the principles upon which we're going to make our decisions of where to go next? And later when you hear from Barb and Spence, you're going to hear how that plays out in real dollars on a scale that we've never seen in this community, I think. But you have to define those principles and you have to agree on them. So you've got this great purpose. For me, it's health. You align people that give you different perspectives of what that means to them and how they'd like to see it achieved. You figure out what principles you're going to use to make those decisions, and then, only then, are you ready to begin making plans. And here's where it gets precarious for your group. And I think you'll also might hear some apprehension from Spence and Barb on this too, just based on our morning conversation. Because when you make those plans and start talking about what you're going to do, people are going to look at you. Some of them are going to look at you funny. And a whole bunch of them are going to hold you to account on what those plans do. So then that comes to the last part, which is really perseverance. Once you've stated those plans, you're going to have to persevere. You're going to have to persevere through criticism. You're going to have to take your group and fall back on your principles that you all agreed how you're going to behave and treat each other and how you're going to stick to those plans, and then see it through. And that's how you get sustainment. But how in the world does that connect to the whole concept of destination health for Wilmington? That's a head scratcher, right? I mean, we have all the pieces that should make for a perfectly healthy community. We have a wonderful climate. We can be outside and be active all the time. We have an incredible food community. We have growing business sectors all over the place. Got pretty good health care, getting ready to get a whole lot better. So why is it not working? What's missing? How does that fit? Well, it really comes back to those P's I just described, right? We have to clarify that purpose a little bit more and say, hey, if Wilmington is destination health, what does that mean for us? Well, I'll tell you what it means for us. It means that we can be the cultural epicenter of North Carolina. It means that the health interventions, not just healthcare interventions that we institute, can take us to the top of the state and can take our state to the top of the country. But so what? What does that mean for us? Well, it means that health insurance premiums can go down. It means that opportunities to pursue business will be incredibly enhanced. We're reducing overhead. If we shave out just a small percentage of what's spent on healthcare on the business side, it can be pumped right back in to what you do in the other growth aspects of your business. This whole concept of belonging is critical for this to happen. But it takes hard work because we have to deal with a few paradoxes. So North Carolina's economy, if you put it on the world stage, would be number 30 globally. Why? Agriculture. Interesting paradox. We feed the world, but we have 20% childhood food insecurity in our community, and it's worse since COVID. You look at other areas that we know that are found in the Healthy North Carolina 2030 plan, which I would encourage all of you to look up and understand. There are 21 health indicators. It's a 10-year plan for North Carolina that gives us a chance to be in the top 10 if we execute on these things, but it's going to take all of us. Severe housing problems. Many of the most influential people in this community have been in real estate and development all along, but we still have severe housing problems. People can't afford to live here, and they have no ability to navigate how to get there. It's a paradox. We're going to have to deal with that. Finally, the growth of our community is massive, and a lot of it is what? Retirees. Yet we have a horrifying problem with social isolation amongst the elderly. It's a paradox. We're going to have to figure that out. So those are just real challenges. And I want to tell you that it is that concept of getting all the perspectives that are going to help us find the answer to those things. I'm very encouraged that once COVID is clear, we'll be able to do that in a much different way. But right now, there's a lot of navigation left to do with COVID. And I want to be clear that I think we're coming into the most vulnerable time. See, I'm living into my purpose. I'm trying to help you be healthy and understand what's getting ready to happen. Because it's probably going to be the darkest time in any of our lifetimes as far as infectious disease in this country over the next several months. There is a light at the end of the tunnel, and the vaccines are very promising. And once we can have mass vaccines, it's going to be a lot better, but that's going to take time because you can just do the math. Coming to our county, there's going to be like 2,500 vaccines week after next. That's it. You know, it's a 2-vaccine series, so it's going to take time to get people to the place that they can be vaccinated. In the meantime, we really got to connect to our purpose, which right now is very clear. Whether it's the economic components, the educational components, or the pure health and being alive components, our number one purpose right now is to get through COVID-19 safely. And that only means a few simple things. It means to wear the mask consistently every time, even if you've had the vaccine, until the coast is much more clear. It means to always use physical spacing. Very important. It means to wash your hands. And it means to avoid gathering. That's a very difficult thing, and as we've heard, it's a human need. And it will absolutely flourish once this is out. But this is the time to hit that last P that I mentioned earlier about what it takes to connect, is that right now we have to persevere. We have to persevere to safely navigate this pandemic. And if we can make it for just a few more months, we'll be in a much better place. And we can really begin that journey of making Wilmington and New Hanover County North Carolina's prime destination for health. Thank you.